going to be discussing persistent pelvic pain in athletes, and with the hope that we can really take a biopsychosocial lens to these needs. And within this title, within the topic that we're covering tonight, we're really talking about three very often held distinctly worlds in our profession. We have the persistent pain, chronic pain world, we have athleticism and sports medicine, fitness, and then we have pelvic health. And I really am I love, or my hope, I guess, tonight is to just bring our worlds together, because when we do that, we really are in a position to be able to help the individual that's standing in front of us and understand them from a whole person perspective. So these are the objectives. I hope you had a chance to read them more specifically before you got here, but we are going to be looking sort of at the bio pieces of the puzzle here to try to understand how pelvic health links out into these other areas, and then look at the psychosocial components as well, of pelvic pain, persistent pelvic pain. And then specifically, we're going to look a lot at overactivity of the pelvic floor. And then I'll very briefly be able to go through some of the research that I've done in that regard. And then my ultimate goal always is for folks to recognize the need for us to value pelvic and abdominal health for our clients across all populations, and the need to understand that fitness of choice is a huge part of whole person care. And that's particularly true when we work with our athletes. Let's go ahead and dive in. I know my poll initially was to just see who's in the room, but I am going to fly because I've got an hour and I want to really nail it. But that generally speaking, these are, again, areas of care that are often kept in separate worlds, but that does not serve that individual in the middle that has needs in all of these realms. And so my goal is always to try to bridge these worlds, to pull together the concepts from each of these worlds, because then we really can offer whole person care, which I think if we could sort of really brass tacks, what is biopsychosocial care? And I think really it is whole person care. And so we need to provide elements from each of these worlds in order to optimize the care, particularly when we're talking about an athlete.